Okay, now I just wanted to ask you about some myths that or misconceptions about nurse practitioners that you have encountered from just different people, patients. So,
Well, the biggest misconception is that nurse practitioners, when they see patients, uh, this was, 10, 15, 20 years ago, as nurse practitioners have gone along, it's a little different now. But then they wanted to know when I was going to finish school, because they just assumed that you were there to practice to be a doctor. So many times I got asked, "Oh, well, nice to meet you. Well, when are you going to finish school?" And I would say, "I have finished school, a lot of school." So, once you get your BSN, and then you have to go 2 more years, I would explain, to become a nurse practitioner. So many people were surprised. They really didn't understand that 10, 15 years ago in the South, how nurse practitioners function. So was the biggest misconception. And they didn't know that I could actually not only diagnose but treat and write prescriptions. So many times they said, "Oh, do I have to wait for the doctor to come in?" I said, "No, I'm going to write that blood pressure medicine right now for you," or if they needed an antibiotic for a sinus infection. So it was just educating my patient population to what we were able to do, our scope of practice, which is very broad actually, depending on the environment that you're in.
any other myths?
Um, I can't think of anything else. Those were probably the two biggest obstacles that I faced. Other than I did have somebody ask me if I could take out their tonsils, and I did have to explain that that was one thing I did not think I could help them with, because I did do suturing, and we did help out with cuts, lacerations, minor things that didn't have to have ER use. So it is kind of confusing for patients to know what you can do and can't do.
Well, thank you for your time.
You are very welcome.
Love you.
Y'all have a great school year.